What is anxiety? Anxiety is characterized by muscle tension and avoidance behavior in response to the anticipation of a future concern. Fear is an emotional reaction to an impending threat and is more associated with a fight or flight response, either staying to fight or fleeing to avoid danger. People suffering from anxiety disorders may try to avoid situations that trigger or worsen their symptoms. Job performance, schoolwork, and personal relationships can all suffer as a result. Anxiety can be beneficial in certain situations. But how do you know when your anxiety symptoms are severe enough to warrant a diagnosis of anxiety disorder? A visit to your family doctor or a trained mental health professional is a good place to start. However, understanding what professionals look for in diagnosing an anxiety disorder can help you prepare for that visit or decide whether one is necessary. There are 11 distinct types of anxiety and related disorders, and each anxiety disorder has a list of commonly occurring symptoms divided into 4 categories. Physical reactions. Thoughts. Emotions. Behaviors. Who is at risk of anxiety disorders? Anxiety disorders can be caused by a combination of genetic and environmental factors. You may be more vulnerable if you have or have had certain personality traits, such as shyness or behavioral inhibition, feeling uneasy around unfamiliar people, situations, or environments and avoiding them. Early childhood or adulthood stresses or traumatic events, anxiety or other mental health conditions run in the family. Certain medical conditions, such as thyroid issues and heart arrhythmias, unusual heart rhythms, anxiety disorders are more common in women. Anxiety specialists have discovered that when people experience anxiety more frequently, for example, most days and for months at a time, and more intensely than others, it can cause significant disruption in their lives. This disruption can interrupt or even prevent adults from participating in a variety of experiences such as higher education, meaningful work, joining social, athletic, or recreational clubs, being in relationships, and more. Finally, it is this combination of factors that increases the likelihood of being diagnosed with an anxiety disorder. Bonus wit. What is the frequency of anxiety disorders? In any given year, the estimated percentage of adults in the United States suffering from various anxiety disorders is 8 to 12% have a specific phobia. 7% have social anxiety disorder. 2 to 3% suffer from panic disorder. Agoraphobia in adolescents and adults, 1 to 2.9%. Generalized anxiety disorder, GAD, 2%. Separation anxiety disorder, 0.9 to 1.9%. Anxiety disorders are more common in women than in men.